Welcome to another video. In this video, we will continue learning mental health nursing starting with nurse-client relationship. Regardless of the specific goal, the therapeutic nurse-client interaction is the foundation of all psychiatric nursing therapy techniques. The first step is to establish a positive relationship between the nurse and the client. The nurse-client interaction needs to be secure, confidential, dependable, and within appropriate and defined boundaries. It takes time to build a rapport or relationship with a mental health client. Note that the factors that promote client growth are communicating genuineness, expressing empathy, and having positive regard for client. This will help build a good rapport and establish trust with the client. The first phase of the nurse-client relationship is the orientation phase. This phase can last for a few meetings or longer. The main end goals in this phase are the following. Rapport and trust is established. The nurse's role is clarified, and all roles are defined. Confidentiality is established. The terms of termination are introduced. The nurse becomes aware of transference and counter-transference issues. Client problems are articulated, and mutually agreed upon goals are established. Now the second phase of the nurse-client relationship is the working phase. This allows for a strong working relationship. The main focus on this phase is the following. Maintain client relationship. Share information and gather further data. Promote clients' problem-solving skills. Facilitate behavioral change. Overcome resistance behaviors. Evaluate problems and goals. Promote practice and expression of alternative adaptive behaviors. The third phase of the nurse-client relationship is the termination phase. This is the final phase of the nurse-client relationship. As the nurse, you will want to do the following. Summarize the goals achieved. Discuss new coping strategies. Review situations that occurred during the relationship. Exchange memories and validate experiences of the relationship to promote closure. That's it for this video. In the next video, we will continue the lesson by learning about communication techniques. See you there.